Member for Albany.
Thank you. My question is to the Minister for Health. I refer to the WA Labor Government's commitment to modernising West Australia abortion laws. And I ask, can the Minister outline to the House how the abortion legislation reform bill introduced in the House today will strengthen protections for West Australians seeking lawful health care? And can the Minister advise the House how this bill has been shaped by West Australian medical practitioners?
The Minister for Health.
Thank you, Madam Speaker, and I thank the member for Albany for her question. As many members have seen today, a bill was introduced a couple of hours ago which will modernise our abortion laws in Western Australia. And essentially it will streamline the process for women of Western Australia. It will remove clinically unnecessary barriers for women in Western Australia. It will provide a more compassionate approach to late-term abortion, providing more time for women to make what is often a very, very difficult decision for them and their families. So it will women will be able to self-refer up to 23 weeks with no referral required, and after 23 weeks 2 medical practitioners need to be satisfied. Mandatory counselling will be removed, the ministerial panel will be removed, and all of these processes will be brought into line with best practice in medicine and also informed consent. Medical practitioners are well educated on how to obtain informed consent from their patients. They do not need to go through another process of so-called counselling or tutoring, if you like. So this will provide earlier access for women who are seeking a termination, whether medical or surgical, and better access for women seeking a termination over 23 weeks, with hopefully limiting the need for women to travel. And importantly, this bill has been shaped by the community, largely women, and by the medical practitioners who will have to operate under this framework. It is so important that clinicians have a clear legal framework under which they're operating in healthcare, but particularly in this particular area. Part of the consultation involves 2 clinical roundtables with representatives from the AMA, RACGP, senior midwives, experienced clinicians who work in this area, clinicians from other jurisdictions, so one from the Northern Territory and one from Victoria. And there were 2 of those roundtables where we really worked through what works and what doesn't work in other jurisdictions, and by and large all of these policy principles were agreed by consensus by those clinicians around the table. There is of course not every clinician will want to be involved, and there is the opportunity for clinicians to exempt themselves from the process, similar to the process that is in place for voluntary assisted dying, is that they have to declare their objection, either refer to a clinician who will support a woman or provide prescribed information to them. So this is an important bill for women in Western Australia, an important bill for those who operate in this area, in obstetrics and gynaecology, and support women in this particular field. And I am certainly committed to a very constructive, a respectful debate in both chambers, and look forward to the outcome of the bill.